Hello and welcome once again to The Blueprint. This is Canada's Conservative Podcast. I'm your host, Jamie Schmale, Member of Parliament for Haliburton, Kawartha Lakes, Brock, with new content for you every single Tuesday, 1:30 p.m. Eastern Time. We ask that you like, comment, subscribe, and share this program. People can also download this content on platforms like CastBox, iTunes, Google Play, and Spotify. You name it, it is out there. Another great show lined up for you today. We are going to talk about Justin Trudeau's wacko drug policy. To talk about that and much, much more, we bring on once again Laila Goodridge, the Member of Parliament for Fort McMurray, Cold Lake. Thanks again for coming on. Also the Shadow Minister for Addictions.
Thank you, Jamie.
All right, we got an absolute wacko policy that's taking in full view of everyone out in British Columbia, where they have decriminalized the use of hard drugs in public places, and now we're seeing a bit of a backlash. Regular citizens who might have been kind of looking at this and saying, okay, maybe I can give this a go, see what it looks like. Now there seems to be a full retreat on that policy. But yet Justin Trudeau seems to be taking a sweet old time despite the thousands who are dying.
Well, exactly, and it's really interesting. So in British Columbia, basically what they did is they went so many steps further by allowing the effective legalization of crack, heroin, fentanyl, and so many other drugs.
And that was wacko in itself.
And that was wacko just in and of itself. And they did it on a 3-year pilot project with British Columbia. British Columbia, 10 days ago, actually 11 days ago, said, please rescue us. This is failing. There is open drug use on beaches where people are smoking crack cocaine and the police have no tools to deal with it. There are people smoking meth in the hospitals, making nurses fear for their safety, making them change their decisions as to whether they're going to breastfeed their children or not because they're routinely exposed to drugs in the workplace. And so the BC NDP extremist premier, David Eby, goes, please rescue us. And now we're 11 days in, crickets.
And we also had a reversal a few weeks before that, I believe, in the state of Oregon, probably one of the most left-wing states, I would say, in the United States, saying they're going to reconsider and backtrack from their decriminalization policies.
Well, and exactly, and this is part of the problem. This isn't just decriminalization, as the left would like you to think. No, this is a step towards legalization. Yeah. This is making it legal to smoke crack on the street in front of kids. This is making it legal to smoke meth in a hospital. You can't smoke a cigarette in the hospital, but you can somehow smoke crack or meth in a hospital, and the police have no tools to deal with this. And that's because of this Prime Minister and his wacko drug policy.
And it's not because they took this route because David Eby, the Premier of British Columbia, or Justin Trudeau became hard-charging libertarians here. This is not why they did this whole thing. And yet we're seeing thousands of people struggling with addictions, unfortunately dying. We're seeing a stress on the healthcare system. We're seeing stress on law enforcement. And they just refuse to backtrack.
Well, and this comes at the precipice of British Columbia having its highest ever number of people that have died due to overdose deaths. And that's just overdose deaths. That's not the people that get stabbed to death in front of their family at a Starbucks from someone that is high. That is not all of the other people that are hurt because of this policy. And the failure to recognize that this is an issue and act is an abject failure of leadership on the most epic proportions, and proves that these policies are wacko, they are ideological, and this is not about anything other than pure politics from this Prime Minister. He has the NDP Premier, who is an extreme NDP, begging for them to have action, and like I said, crickets.
But it's because Eby's numbers went down. Again, he's not a hard-charging libertarian. He changed course because the policies were very unpopular. And they got a provincial election coming up.
Well, but they've also been able to see, and we've had it in our health committee, we've been studying the opioid crisis in our health committee the last number of months. And we had the deputy commissioner from Vancouver City Police come and talk about the fact that they did not have the tools, and she would want exceptions to the exemption to give them the tools so they could charge someone for smoking crack in a hospital or meth on a beach or shoot up heroin in Tim Hortons. We heard that very clearly just a few weeks ago in Health Committee. And so I think that is part of why David Eby, it's not just that it's unpopular, it's because he's starting to hear very clearly from law enforcement that co-signed this horrible, failed, wacko policy that this isn't working and they need help. They need to be rescued.
Let's cue up cut one. So we have the addictions minister, Yara Sachs, who is a horrible minister, absolutely horrible at her file. Basically, it's under review, that request to return.
They hold the
bring
pen.
It back. They hold the pen.
They hold the pen.
But it's under review. Let's play cut one.
Make a decision about BC's request.
As I stated yesterday, we received the request on Friday and it's under review by Health Canada.
What is the deadline? How long? How long is it going to take?
We are still under review.
And how long?
We're still under review.
Can you quantify, because BC says this is urgent?
We understand the urgency.
The opposition says that you're not ruling out further decriminalizing hard drugs. Is that true?
We are reviewing their request at this time. Our focus is that this is a health issue and we do not want to see a recriminalization of people who need health care.
They aren't talking about treatment at all.
No.
Not one time in the House does that minister ever talk about treatment.
No, and to make matters even worse, we have the City of Toronto who is pitching their own legalization model, despite major noise and criticism from the province of Ontario. And they won't just say no. They won't say, no, we will only work with provinces. We get one message from one Toronto minister, the Minister of Finance. We have a different minister from Toronto, Yara Sachs, give a different answer. We have the Prime Minister give yet another answer. So what is the answer? Canadians don't know, but the answer isn't no.
That's right. But we did actually get an idea of what's in their head. Potentially the former addictions minister, which you did a bit of work at committee many moons ago. But the fact that it's on record that they would reconsider potentially backtracking on their policy. That was the old minute. That was the old way.
That was
the old way.
Old way of thinking.
Yes.
With someone who was a bit of an expert, who was a medical doctor before she got into politics, who clearly understood that you had to take into account both public safety and public health. Now it's just pure ideology. They're going to go full steam ahead because they can. All
right, let's cue up cut two. This gives you an idea of the Liberals' mindset about 10 minutes ago, and then we'll understand why we're at the point we are now. Play cut two.
So what criteria are being used to measure the success of BC's decriminalization pilot project?
Okay, there are 6 criteria that were part of the application.
What are they?
The increased in health and social services, continued stakeholder engagement, public education, law enforcement, engagement with Indigenous peoples, and robust evaluation and research as we go forward.
So do you commit to stopping decriminalization should these outcomes not be achieved?
Absolutely. We have always said that if this isn't working, both on the public health indicators and the public safety indicators, we will be watching those.
On that criteria alone, we should be able to have the Prime Minister to shut this down.
Well, and it's not like it's just the opposition asking for this. This is the NDP Premier saying, rescue us from this failed policy. And this just goes to show that none of that is being taken into account. The fact that they are 10 days, 11 days in, still analyzing the data and won't give us a date, wouldn't just say yes and figure out the details afterwards, shows that they don't care, because this is something that is supported by our NDP Liberal coalition government here in Ottawa, because the NDP here in Ottawa think this is brilliant. They want to see this expanded all across the entire country, and they think this is the panacea to the drug issue. This is absolutely wacko.
I still don't understand their logic about that, right? I just can't figure out their path when the sad part of this all, the unfortunate deaths, the thousands of people who have lost family members, friends, you name it, and there seems to be no reversal or even thought to reverse it. It's just full steam ahead.
Well, and this is part of the major challenge. And like, we're talking about brothers and sisters and moms and dads and cousins and neighbors and family that are dying every single day in British Columbia. And yet we don't hear any urgency. They're just so committed to continuing with this plan that the premier, police, law enforcement are saying isn't working. And they just are so committed to seeing this through and using the guise of, oh, this is a pilot project. Well, exactly, it's a pilot project. And so they could just say, we were wrong, we have to reevaluate, we'll figure out the details. But instead, they want to make this about politics. They want to make this about proving that somehow this is more compassionate. And we know, conservatives, common sense conservatives know that the compassionate way to approach this issue is with treatment and recovery, detox, not more taxpayer-funded drugs, not a free license to cause crime and chaos on our street. It's through treatment and recovery.
So what if the City of Toronto gets their way?
We're going to see more crime and chaos. We're going to see more despair, more destruction. What we really need is a common sense conservative government to come in and really put the emphasis on treatment, recovery, detox. And because really, at the end of the day, the difference is that conservatives, we believe that recovery from addiction is possible. And I don't think that the Liberal NDP coalition thinks that
Well,
it's
even on the
possible.
criminal justice side, we have new legislation that has been brought forward in the recent years that has basically made it a revolving door justice system. So even if you have people out there, repeat violent offenders or dealers, that kind of thing, even if the police arrest them, they seem to be back on the streets within hours or days, right? This is a circle that you can't break from.
Well, and under this insane legalization in British Columbia, what it's made it is it's tied the hands of police so that they can't charge for flagrant open drug use. They can't do anything when they have people in these positions. There is like lawlessness. So if you were a smoker, you would have more restrictions on what you could and couldn't do to smoke tobacco than you have on smoking meth or crack. That is wacko.
And even law-abiding people, they bring their families in the park, they go out to play, they're looking at needles potentially. We've seen multiple reports, people doing open drugs. Like, how do they feel? They've done everything right. They paid their taxes, followed every law, and they have to endure this.
Well, and this is part of the huge issue that we're seeing is you go through almost any community in British Columbia right now, and there are playgrounds, children's playgrounds, that are supposed to be safe places for kids to be able to go play and be kids, are littered with needles. There are crack pipes strewn about, so glass with drugs on them, just strewn about. Parents are having to do sweeps, which is meaning that the kids just can't go to the playground and be kids. It's requiring communities to come together. We've heard the Abbotsford Soccer Association that's had to do major sweeps of the field just so that kids can play soccer. This is absolutely inhumane that we have accepted as a society that open drug use, it has become an absolute free-for-all. That was not what this was supposed to be, and the Prime Minister holds a pen. The Prime Minister could end this tomorrow. The Prime Minister could have ended this 10 days ago. He could have ended this a year ago. But instead, he is committed to pushing forward with this failed policy because he can. And that's wrong.
Yeah, it's almost as if the Prime Minister doesn't want to take that step back to admit he's right. Or, sorry, he's wrong.
Well,
Like-
and I think this is part of the problem.
That we're right and he's wrong.
And the Prime Minister is so committed to this failed wacko policy that he won't just take the opportunity to humble himself, admit to Canadians, you know what, this was a pilot project, we tried it, it's not working, we made a mistake, we're going to do better. No, this is the Prime Minister that's all about divide,
Oh, yes.
wedge, stigmatize, and create all of these problems. And that is the fundamentals of where we're at, why we are where we are.
Oh, absolutely. I don't think this Prime Minister has said sorry or taken anything back that he's ever done. SNC Lavalin, the trips to billionaire, the list goes on. Anyway, we're pretty much out of time, but as you know, the guests get the last word. The floor is yours.
Well, the number one last word is if you're struggling with addiction, reach out. If you need some help, if you've listened to this, if you've got a family member that is struggling, you're not alone. Reach out for help because recovery is possible. We believe that people are capable of recovering. People recover every day, and so they just need the support. If you need support, reach out. There's lots of resources available.
And we have the new tip line as well, the helpline, I should say.
Yeah, and so if there's all kinds of different concerns, and so we'll have that shared up on the screen, some of the different resources you can access if you or a loved one is struggling with an addiction.
Absolutely. Thank you very much. Laila Goodridge.
Thank you.
Appreciate your time. The Member of Parliament for Fort McMurray, Cold Lake, also the Shadow Minister for Addictions. Great content here you're probably not hearing in the mainstream media, especially this side of it. They seem to be all one-sided, supporting the Liberal Party. So that is why we ask you to like, comment, subscribe, and share this program. Tell your friends. They can download it on platforms like CastBox, iTunes, Google Play, and Spotify. It is out there if you need it. New content for you every single Tuesday at 1:30 p.m. Eastern Time. Until next week, remember, low taxes, less government, more freedom. That's the blueprint.